Great. As you can see, my name is Meron. I am honored to be the moderator for today's discussion. This is sponsored by Habesha Health, habeshahealth.org. We were, I guess, reminiscing a bit before we started, and Mimi and I have known each other for close to 18 years. That's how, a person has been born and a full adult at 18. So her and I go back all the way back to 2000. I'm not going to say
2003.
I can't think of the math right now. But
2003.
there we go, 2003.
Yes.
And we kidnapped Mimi to be our friend. And she has stuck with us whether she wants to or not. A little bit about me. I am an accountant by trade. I'm currently pursuing hospital chaplaincy. I'm going to say a couple of things about Mimi, and I want to say a couple of things about Hiwot. Just to be clear, I was referring Mimi to Hiwot. I'm going to say a couple of things about Hiwot, and I'm going to let Hiwot tell us about her credentials, since I don't want to mess that up. But I've known her for so long. She is committed, okay? She's driven, she's passionate, and has a desire to make a difference on those that she serves, those that she lives with, and make even an impact on earth for, with the years that the Lord has blessed her, and we believe for many, many years. And I always say to her, any time spent with her is time not wasted. So Hiwot, could you tell us a little bit about your credentials and what you're currently doing?
Yes, thank you, Meron. So I am a licensed clinician in the state of Virginia. I provide counseling for children, adolescents, and adults. Currently, I have my own private practice, as well as I work with a school system, with a public school system. There is a special program that they run. So my focus is, on mainly mood disorders and behavioral challenges. I work with couples as well. And obviously today's topic, trauma. So I've been practicing since 2012. I've been, like I said, in a private practice. I have worked in a hospital, residential setting, in the community. I lived for several years in the Chicago area, so I have worked within the community in the Chicago area, and then here back in Virginia. So I'm excited to be back and to be doing this, and thank you for having me.
Today's topic is trauma-informed approach to self-care. Just to give you a preview, we will discuss what trauma is, what it means, the warning side, how it affects us, and ways to cope. We believe this discussion will be educational and hopeful. Some might be wondering, either audience now or later and watching, why trauma, why it's important, or why am I hearing about trauma now? But I think it has, and of course, Hiwot will discuss further, but trauma had used to be or limited to maybe those in the military or those with serious traumatic experiences, life experiences like abuse, rape, or war. But if we look closely, and we will learn more from our discussion today, it is a common thing. It's everybody has experienced some level of trauma, especially now with COVID, and now post-COVID or during COVID, wherever we are, we've all partaken some type of stress that might lead to trauma to some capacity. And some have, of course, and to some, this COVID pandemic has affected them at a significantly severe rate than some of us. But have no fear, Hiwot, our therapist Hiwot will help us figure this out today. So, the first question for today is, Hiwot, what is trauma?
Okay. So again, thank you for that introduction, Meron. So trauma, like you said, and not too long ago was believed to be, it's people who are coming back from, war and have seen or experienced or been in that kind of setting or environment. And also, even after the fact, when they started to realize that, trauma is actually more common, even then, more was geared to, either rape or some sort of sexual, emotional, or physical abuse. But now we understanding that it's more than that. So the one definition, a lot of, whether it's the mental health or the counseling or the psychology or, any medical terminology or providers, the way they describe it is when an individual faces an event, or it could be multiple events or circumstances, and then their experience of that event leading them to really lasting effect. So in general term means that any event that happened in your life and how you experience it, if it leads to a lasting effect that are causing you mental, emotional, or physical challenges, it could be classified as trauma. So a good example would be, for example, you might get into a car accident, or you might have a family that got in a car accident and have seen it, and that could be trauma, right? So the level of it is kind of talking about a spectrum, right? Like I said, we're not really saying that, unless you have experienced some sort of abuse or rape or any sort of that, bigger events, but anything that is leading up to an experience that is challenging to you could be trauma. And then there are 3 types of trauma. Actually, there are more than 3 types of trauma, but the main one that we're going to focus on today is, for example, when we talk about acute trauma. So acute trauma is really talking about one event that happened, that you have experienced, that has left a significant effect on you. That, like I said, it could be losing loved ones, it could be car accident, it could be natural disaster, or you've been robbed, or any sort of things, or you have witnessed, that's another one, domestic violence in the house. It could be a one-time event that you have witnessed. So any of those things that leave you feeling unsafe, threatened for your life or for somebody else's life, and that is impacting you. So that we call it an acute trauma. And the second one we talk about is chronic trauma. So chronic trauma is when an event is happening multiple times, right? So that could be, for example, a good one, like I said, would be if there is an abuse in the house, whether that's physical or emotional, or you witnessing domestic violence in the house, whether that's your mom being physically or emotionally being abused, or whether it's your dad that's being physically or emotionally abused, or however you see it, right? Or if that's happening to you, right? So it's kind of the same kind of event happening multiple times. So that would be chronic trauma. And the third one we're going to talk about is complex trauma, right? So complex trauma is really, it's like the word says, complex. So it's really about multiple form of events happening that is causing you traumatic stress. So there might be neglect in the house. There might be domestic violence in the house. You might be physically and emotionally being abused, right? Or you might be living in the area, the environment is unsafe, right? There are gang involvement and people dying around you, or there's shots or things like that. It's not safe. Or you are worried about whether you're going to eat tomorrow, whether you're going to have food tomorrow or not, whether you're going to be safe or not, or any of the combination of these different types of things that are going on in your life, that we call it complex trauma. So any of these things, if those things happen in your life and you're experiencing it as unsafe, threatening for your, well-being, that could be trauma or traumatic experience.
Thank you.
Mm-hmm.
I think it's nice to you therapists help us put words to how we feel. Sometimes we minimize it, but then I liked how you broke it down and told us the different forms of trauma, because you had to mention all trauma is not created equal, like a lot of things. So I think it's important that we hear there are different types, and perhaps your case fits in one of these. So it was really good that you mentioned those. In your definition, you talked about the experience part.
Mm-hmm.
And now, based on our conversation earlier, we talk about, and this is maybe a little bit more within the Haftar community, we're quick to dismiss or minimize our experience compared to others. Can you talk about that experience part of the definition of trauma?
Yes. So, I mean, when it comes to really trauma, when we are talking about trauma, it boils down to experience, right? So what does that mean? That means that me and you can be witnessing the same event, and you might not experience it the same way that I do, right? So I might have, and let's just take the pandemic, right? So the whole world is going through this, right? And some of us are able to manage it, deal with it, and move forward. And for some, it is the most challenging and difficult time where they have felt insecurity, unsafe, threatened, or however you want to word it. And you're looking at it, it's the same event, right? So that's the big part, is that a lot of times when people are speaking to us, and like you said, especially in our culture, when people are talking about their experiences, we tend to, and it could be out of habit, where we say like, oh, that's just, like some simple thing or minor thing, or we'll just kind of like, oh, you'll be okay, or we kind of minimize it and brush it off. And what that does to that person is, it really is very invalidating, right? So how I experienced it and how it made me feel and how I continue to have all these symptoms because of that event, eventually I start questioning myself, right? Saying that, okay, maybe I'm wrong, right? Maybe I shouldn't feel this way, right? But reality of it is that we don't choose to have those feelings and emotions, right? So when we are talking to friends or loved ones or things like that, when they are talking about their experience, it is their experience, right? Like I said, I mean, in my experience, I have seen people who have been emotionally abused and physically abused, even some sexual trauma in their life, and they are able to, work through it and deal with it, right? And then somebody else is struggling, but that doesn't make that person experience any less from this person, because this person was able to cope and deal with it, right? So again, that kind of going back to and being able to say, it's their experience, and how can I validate their feelings and their experience and be a support to them, rather than looking at it from my lens, from my view. And just because I don't feel that way about it doesn't mean the other person can or shouldn't and couldn't.
I think that's a wonderful perspective. Your experience, your event, right? Or if I speak for myself, my experience, not Hiwot's, it's a good reminder for us as individuals. I think it's also a good reminder for those that we care for, right? And I think you could agree with me if I say, sometimes it can be hard if we're not very thorough with what we're feeling, how we're feeling. Sometimes stress, traumatic stress, and regular stress looks alike. And I know everybody can understand what stress is, right? We've all experienced some type of stress, even pre-pandemic, either work, life, responsibilities in school, outside. But sometimes it's a little tricky to navigate between those two. So Hiwot, if you can help us navigate between the difference between, or key differences between stress and traumatic stress?
Sure. So like you said, you're right. I mean, stress happen every day, right? It could be from being stuck on traffic, running late to things, or we having a due date, for certain assignments or tasks and things like that. So stress is normal, right? Actually, stress to a certain extent is like a motivation, right? When you feel that stress, you for example, if you have an exam to take, or if you have a presentation to do or whatnot, that stress it's kind of encourages you to do more, right? You prepare more, you make sure that you got your things done, have it ready and things like that, or you study more days than you would normally do and things like that. So it's normal, and it's really important to a certain level, right? But the difference is also, one of the other differences, that when we feel stressed in that moment, we have feelings and emotion connected to that stress, right? But we are able to manage and cope with it and deal with it and be able to move forward. When it comes to traumatic stress, again, this is an event happening that triggers an intense feelings and emotion for you. But the difference is that it peaks and stays there, right? So normally, if it was going like this, what ended up happening is that it peaks, it stays there for a long period of time, right? So for some of us, it might be a week. For some of us, it could be a month. For some of us, it could be 6 months. For some, it could be years, right? Or a lifetime, right? So in that state, which means that we're not really able to cope with it and effectively deal with what has happened in our life and be able to move forward, right? So different circumstances in our life is bringing those feelings and emotions. We are reacting in a way that, if something reminds us of a certain things in our life about that event or something that happened in our life, it gets triggered, right? So we feeling that tenseness and that unsafeness throughout our life, right? Or, like I said, 6 months or a year, or, depending on what kind of experience that you have about that, right? So stress is something that it comes, we deal with it, and then it goes away. Versus that the traumatic stress it's something that kind of stays with us and continue to impact us, and really in our day-to-day life, in our relationship, in our marriage, in our career, and all throughout, and everything that we do, it becomes part of that and being impacted by that.
I like how you use examples, because I reflect on our college years, and it was stressful, but it was a passing off. And then we look back saying, whoo, those times were hard. Mm-hmm. But we were continue with life. Would you say a good indicator of, hey, maybe I'm passing from regular stress, everyday stress, perhaps healthy stress, right?
Mm-hmm.
Something that needs to be checked out with, something such as if a person finds themselves saying, I can't handle this, I don't think I can continue with life. Do you think those are perhaps indicator of we're shifting?
Yes. So, I mean, like I said, the experience is individual, right? So part of it is going to be for that person. And then again, it's either for ourselves or seeing it in our loved ones, to be able to notice some of the warning signs, some of the signs, right? To be able to kind of, okay, I've been struggling with this, right? This has been in my mind. Or I have been avoiding certain things or certain places, or, I'm not sleeping very well, or I'm not eating, or whatever the case is, being able to recognize those things and really to be able to say that, okay, well, this has happened 2 months ago or 3 months ago, right? And I'm still struggling with that, right? And then kind of that event or that experience, when it starts to come part of the things that we are doing as we move forward, right? If I'm making decisions based on, how I feel in that moment because of that experience, rather than what's going on right now, right? Like I said, it starts to kind of insert itself in our day-to-day life and different things that we do, then that's a good awareness to have, and to be able to say, okay, maybe I need support, or I need to seek professional help, or whatever the case is.
Good point. Hiwot, you corrected me. I was trying to say if I feel this way, and you were quick to remind me that, again, it's individual experience, right? What I think might be out of norm for me might not be out of norm for somebody else, or vice versa. I think, I don't know if this is a good thing or a bad thing. I've always felt like I can tolerate stress a little bit more than everybody else when I compare myself, but I also have to remind myself, like you had reminded us, what I tolerate and what somebody else tolerates. I am not the measuring stick. I am only the measuring stick of myself. So if I can overcome ABC, does not mean I should require my sister to be okay with experiencing ABC, you know?
Yes.
Thank you for catching that.
Of course.
You know, as they say, wealth is key. Or sorry, health is key. Wealth is key too.
Health
Today, health is key. I wanted to encourage our audience that it's better to invest in our health than underinvest, meaning check on little things, you know, if you can encourage us a little bit on that.
Sorry, I think there are some questions coming in. Just giving a heads up. Sorry, but go ahead. I got a little bit distracted.
Okay. Do you want to go ahead and answer that question, or do you want to wait for later? I'll make sure. I know that.
Okay. It's up to you. And we can keep track of it, and then we can get to the Q&A, or however. But my apology, I got a little bit distracted. What was the question?
Harfi, no problem. And Mesera, we do see your question. Thank you. I said, as they say, health is key. So how can you encourage us to over-invest in our symptoms per se versus under-investing, meaning like over-investigate versus downplay?
Downplay, yes, yeah. So I'm glad you say that, because I think that actually go into some of the cultural aspect of it too, right? Because a lot of times, even in our culture, we tend to minimize a lot of things, a lot of our feelings, our emotions, experiences that we have, right? We are very good at comparing, right? Saying that, you know, like that person, for example, like I said, if me and you were in the same event and I experienced it, I'm more likely to minimize my feelings and my emotions, because I'm saying like, oh, Maron was there with me, she's okay, right? And sometimes we do that too. We kind of indirectly ask certain questions to kind of like to see how you're doing, so that I can gauge whether I'm overreacting or not, or whether I should be quiet or not say anything or anything like that. So it's important for us to be able to kind of listen to ourselves, and then be able to say like, okay, what can I do to take care of myself, right? Because everything is connected, right? Our mental health. And I think that some of the things that we need to be mindful is that when our mental health is impacted, it also impacts our physical, right? So I think me and you were having this discussion, like if someone broke their leg, they would not say, oh, I'm okay, I'll be okay, you know, it will heal on itself, or I'm not gonna tell anyone or ask for help or anything like that. We're more likely to go to a doctor to get help, right? Or if we have diabetes, if we have cholesterol or anything like that, when it comes to physical health, for a majority of the time, I think that's also another cultural thing, you know, or even just because we live in a country that we're not really either born in, or we just came in, so we have that mindset of that, I got this, I can manage this, I can deal with this, right? Not seeing a doctor or taking the doctor recommendation or anything like that. So doing the same thing for mental health as well, right? Investing in our mental health, checking in with ourselves, and recognizing, and if I'm noticing that there is a change, if there is a shift in my well-being, mental health, then I need to do this, I need to take the same step that I would take for any physical illnesses that I might have, right? So being able to, again, mindful about any of warning signs or symptoms or feelings and emotions that we experience, and understanding that that's mine, right? Again, feelings are individual, right? The same experience, different feeling for different people, right? And sticking and understanding and believing that and validating those feelings and emotions that we have, and being able to really take the steps to seek help, to seek support, right? And like I started by saying that they're all connected. If I'm not taking care of myself in the mental health aspect of it, it's going to impact my physical, right? And the same thing, if I am not taking care of myself physically, it's going to impact my mental health, right? My mental well-being. So we have to do these things, especially we all have plans, we all have goals, we all have futures, right? But none of those things can be accomplished if we're not taking care of ourselves, right? Those, the physical and the mental. A lot of times, I know I'm repeating myself, the mental piece gets neglected, right? For us, for Habesha culture, it's because what we have seen in our home, it's what we have been exposed to in our community, and things that we have seen. And I said in our culture, Habesha, but even in the African American community, when it comes to mental health, it's completely different, right? So being able to take care of ourselves, mental well, as well as physical well-being. Doing those things, seeking those supports and helps when it's needed, I think it's important, and we owe that to ourselves and as well as to our loved ones. My favorite thing to say, put the oxygen mask on you before you can help anybody else. If I'm not well, whether it's mentally or physically, then I am no good to anybody else that I claim to care about, right? Because if I don't have enough in me, I can't pour out, right? And that includes, like I said, the mental well-being as well as the physical well-being. Those are very important. And the other piece, I know I didn't mention it, is the spiritual piece. Whatever your beliefs are, whatever your religions are, or, you know, that there is a spiritual piece as well, right? So a combination of those things to be able to take care of ourselves, and not kind of a wholesome approach rather than just, you know, singling out one or the other.
Yes, excuse me. I think you nailed it well in our previous conversation when you said your psyche is injured, a part of you is broken, and like you had mentioned, sometimes, you know, your leg is bleeding or not functioning. And I know I don't want to go there, but I know in general, I feel like as Habeshas, not all of us, but or because of lack of resources or even time, ability, we neglect some parts of our health needs. But then eventually we're pushed because we can't walk, we can't see, you know.
Yeah.
For example, simple basis. It took me forever to go get some eyeglasses because I was fine reading, but I was struggling a little bit. But I was just like, oh, I'm fine, I can still read, until I said, Meron, you've been paying for this insurance for too long. What are you doing? You know.
Yes.
So I like how you mentioned it. Some part of you has been injured, so pay attention to it.
Yep.
Thank you for the encouragement.
Yeah.
To respect our time, I wanted to shift a little bit to paying attention to children who exhibit symptoms of trauma. Our audience can be parents, or can have friends who have kids, or can be also teachers and whatnot, or, you know, work with children on a regular. So could you tell us why it's important to pay attention to children who exhibit symptoms of trauma?
Yes. So I think that's it's very important, especially for parents and adults, to recognize that we adults and children don't experience symptoms the same way, right? So a lot of times when it comes to kids, it comes out as behavior, right? So we are very quick to focus on the behavior and not really focus on, okay, what is causing that, right? What is driving that? So it's important to recognize, just because, and again, it goes back to what I said, that we don't experience it the same way. It's even different for children, how they experience it, right? So paying attention to those signs, those warning signs, is going to be important. And instead of saying, oh, he's just acting out, or he just upset or angry, or whatever the behaviors might be, to be able to say, okay, why is this happening, right? Especially if we've seen some of these shifts, to be able to say, okay, I'm noticing these behaviors, or I'm noticing these things that were not, part of my son or my child or my cousin or whoever the person is, to be able to say, let me find out, right, what's happening. And I think that part 2 is very important even for adults. Like I said earlier, it's different from person to person, how we experiencing it. And symptoms could be mental, it could be physical, right? And it could be behavioral, right? And like I said, a lot of times kids might complain about physical, or they might show behaviors, right? But recognizing those things, and to really understand that it doesn't have to fit like the box for us to just check and say, okay, unless they're doing or showing these things, then it's not. No, it's different. And let's just find out. I call it a mini investigation. Let's just do a little investigation. Let's have a conversation with them before we kind of jump to conclusion and just label it this way or that way. But really checking in with them, talking to them, reaching out to some friends, and especially for our children, talking to their teachers. How are they doing in the school setting, and all those things, to really have enough information so that we can be there for our kids and be able to support them and get the help that they need.
Thank you. Focusing on the effects of childhood trauma, we talked a bit, Hiwot and I talked a bit about old or childhood trauma can become new adult trauma. So can you talk about it? And you had also mentioned how something caught at a younger age can have a better chance. So can you talk about that a little bit?
Yeah. So, I mean, a lot of it. So there's actually a study, adverse childhood experience. That's a study where they did, and they realized that really majority of us have experienced some sort of adverse childhood experience. So 61 to 67%, the study says 61 to 67% at least experiences one adverse childhood experience. So those experiences really kind of, witnessing certain things in the community or in our home, or we've been exposed to a certain thing, could be neglect, and like I said, not having enough to eat, or your country is a war, or there is a racial conflict going on. So all those things, something that happened in our childhood that might have impact as we grow older. So the more adverse childhood that we have, then the vulnerable that we become as we grow older. So that is really important to understand and not dismiss some of these things in our life, that because sometimes you kind of say like, I don't know what happened, it's just hit me out of nowhere, or this happened or that happened, or whatever the case is. And we're really not looking back and really understanding why that is the case, right? And they did a lot of study where they have talked about that people who had higher 4 or more adverse childhood experiences are actually in their adult life are struggling mental health, are struggling with addiction, are struggling with relationship or careers and things like that. So again, whatever happened in our life, in our childhood and moving forward, that has left an impact, right? And our how we experienced it. And if we haven't addressed it, if we haven't, even the simplest thing that I normally say is that acknowledge and validate, right? Just doing that, being able to do that has a lot of impact as we move forward. A lot of times we're ignoring it, we're neglecting it. And for some of us, we're not making that connection. And I know, Maronia, we have discussed about, taking some of, the counseling classes, and you're like, oh my gosh, that's me. I have that, or whatever, however you say it. Because yeah, we all have had some sort of adverse experiences, but we're not really aware of those things or acknowledging those things, or we didn't have that support system or community to really help us understand what those are and be able to cope and heal from them. So that leaves a scar in us, right? Like earlier you mentioned, trauma is a wound in our psyche. And if there is no healing, then that's something that we continue to carry in our life. And it definitely would have impact in our adult life as we continue to move forward.
Thank you. Yes, I was telling Hiwot that when I took my basic counseling classes, I went home and I was labeling everybody with issues, which I was right. And then my youngest sister wasn't really pleased that I was labeling our parents a certain way, but I had mentioned earlier, Hiwot was labeling how we feel on those forms of trauma that she mentioned earlier. Sometimes when we see a definition and the symptoms behind it, could be like, this is how I feel, and you have helped me put a word on it, a label on it. You put a definition, or maybe a diagnosis for some on it, so I can say I have this. So to help give more weight, validate how I feel. So you're really helping us put words, clinical words per se, or for this. I see some questions, but I want you to pay attention to Tibby's question on stats. If you can repeat that for her. She had asked, can you please repeat the stats about adverse experiences? I don't want to miss that for now, but Meseret, we also see your question.
Sure. So what they did the study a while back, and continue to do that study, but they identified that 61 to 67% of us have experienced at least one adverse childhood experiences, right? So like I said, something in our childhood that has happened in our life that we have experienced. And then, like I said, some have more, 2, 3, 4. Actually, I don't know if I have it in the blog, but you can definitely go to cdc.org or gov, one of the two. There is the survey where you can actually take and answer some of the questions, and it will let you know how many of them that you kind of check boxes, and they will ask you. And some of them are geared towards this here, kind of asking like, was there anyone in your household that was incarcerated or things like that? But really, we can relate to most of the questions that they have. So you can definitely go to that website and take the quiz, not a quiz, a survey or something like that. And it will tell you how many ACEs you would meet, and kind of give you more information.
Thank you, Hiwot. The audience, Habesha Health had tagged in the cdc.gov, and I also on habeshahealth.org. Since it is an educational platform, I believe they also have resources of where to go. As the links that Hiwot was talking about, I'm sure they have those resources as well for you to navigate. I want us to shift a little bit to maybe a different part of our discussion. A person might say, Hiwot, I think I'm experiencing traumatic stress, or I know someone who does. What should I do? Where should I go? Starting point.
Yeah. So like I said, it's kind of in a spectrum. Not everything requires a professional help, right? So that's where a lot of the self-care comes in, right? So like I said, the first one is gonna be acknowledging, right? Really looking and being honest with ourselves without judgment, right? Like I said, trauma or a traumatic event happens to all of us, right? It's really kind of a matter of time when, and then depending on how we experience it, right? So being able to recognize and say, hey, yes, I have experienced this and I have these feelings and emotions, right? Just even acknowledging and giving it voice is going to be very important, right? That's the first step. Because if you can acknowledge something, you can't work through a solution or be able to solve it, right? So once we really acknowledge and say, okay, this is happening, this is going on in my life or my loved one, then the next step is going to be able to say, okay, what can I do, right? Is it something that I can take care of myself, right? What changes do I need to make in my life? That includes getting a good sleep, eating healthy, exercising, creating or investing more in my habits and interests that are important to me, right? It could be journaling, but any of those things that's going to help me, right, effectively cope with those things. Social support is going to be very important, right? Habeshai community is very known for our, community life, right? We are good, with family gathering and all these things, but it also has its own barrier, right? When it comes to these things, even with all that, our cultural love and support and family, when it comes to mental health, we're very quiet, we're very silent, right? We don't talk to people, we don't reach out to people, but it's very important to really say, okay, who is this person that I can identify that I would feel safe and comfortable with to have this talk, right? To even reach out to them and say, hey, I'm recognizing A, B, and C in my life, right? I'm noticing that I'm not sleeping. I'm noticing that I don't have energy or whatever, or I'm feeling this way or that way, right? To have that discussion, to have that, communication. Like I said, with the Habeshai community, we feel that it's a weakness, right? It's, there's a stigma. Yes, there is still stigma here, but even more in our community, there's a huge stigma, right? Because we're not just focusing on us, we're literally saying that it's going to impact my family. People are going to see my family as, some sort of broken just because I am, expressing my feelings and emotion, or I'm acknowledging and seeking help and support, right? But it's not, right? Like I said, the study says at least 61 to 67%, that's a lot to have some sort of, experiences, adverse childhood experiences, and then how that kind of move forward and into our adult life, right? So being able to really have support system and be open about those things. And like we discussed earlier, if you have a broken leg, you will seek support, you make changes, you make adjustments, right? You make sure that you're doing what you need to do, your broken leg is healing. So we have to do the same, right? So acknowledging, seeking support, talking to people, validating my feelings and emotion, not comparing to other people, being compassionate toward myself. Oh my goodness, that's a big one. We are very hard on ourselves. We are very judgmental. If a friend came to me, I probably will give them the best advice. When it's to me, I'm very hard. I shouldn't feel that way. I shouldn't feel that way. I shouldn't be doing that, or I shouldn't go there, or a lot of those shoulds and judgments and critics that we have about ourselves. But we need to remind ourselves to be compassionate, to be kind to ourselves, right? To really give that same compassion and love that we would give to other people, to really return that to us and be able to say, okay, what do I need? What do I need to do to take care of me? What do I need to do to heal from this? right? Like I said, it doesn't have to be the big trauma. We call it the big T. I don't have to be, I don't have to have physical abuse or emotional abuse or sexual or rape or none of that. But what I experience is causing me pain. So I need to acknowledge that and attend to that, right? And be able to say, what is it that I need to do to take care of me, and taking that action.
Really good stuff. You mentioned a lot. And I think it's worth repeating. Acknowledge, validate, acknowledge, validate. That's the beginning.
Yes.
And we talk about how soul work is hard work. I know we have the layers of everyday humans knowing that, you know, the phrase goes, check on your strong friends or something like that, meaning like you have just mentioned, Hiwot, we are you in your profession and in your interaction with your family and friends, you know how to give the best advice, but the best advice to self or to be kind yourself can become a little bit difficult. So there's a saying of soul work is hard work, you know.
Yep.
So
yep.
And we had mentioned in another discussion, I think you believe you answered some of the questions currently, but we have the layers of, for us being Habesha, this being a Habesha platform, and then we have the layers of being an immigrant. We have the layers about the responsibility we have or the burden we feel to our community, to our family, just how well we should do, and we shouldn't be complaining about little things. But the mental shift is necessary. Somebody's asking, how can we encourage? And I believe conversations like this, Habesha Health, that holds, and Hiwot and with her practice is the beginning of better change. And some things have changed, and you have shared. We also share similar burdens with other ethnic groups as well. You know, it's not unique to us, but we're a little bit behind. But I believe these conversation of with our therapists or Habesha community going forward and being in the healthcare field, discussions like this, you had mentioned about the experience, don't minimize it, your unique experience, you know, so those are key beginnings to a better future for all of us. I wanted to shift our focus to self-care. I know you mentioned a little bit, but if you could revisit that again. You had mentioned earlier, not all things lead, you know, to the big T. But there's something that we talked about in our conversation. There's some things we can do before, during, and even after.
Yeah. So like I said, so the first one, once you have an awareness, either something that's going on in your life or something that's going on in your family, loved ones, is that once you acknowledge that, like I said, the next step is kind of differentiating and being able to say, is it something that I need to seek professional help, or are there things that I can do, right? Even as you're seeking professional help, a lot of it is also gonna be the work that you have to do outside of therapy sessions, right? Like I said, it's about noticing and validating your feelings and emotion, giving your feelings and emotions a voice. You're not minimizing it. You're not disqualifying your feelings and emotion based on other people's experiences or what they're saying to you. Being mindful of who your support system are, right? If you go into friends and families and you kind of talking or experiencing your feelings and emotion, if they are shutting you down, if they are minimizing it, or you know, if they just talking about from their experience and you feel like unheard, then that's important for you to recognize and say, okay, who is that person for me that I can go to, that I feel safe and I can trust in talking about these things, right? So having that person in our life is really going to be important. The other step is going to be, no one can read our mind. Like I said, a lot of people are going to see our behavior, right? And really just focus on the behavior, but no one really saying what happened, right? And really in trauma-informed care, that's actually very important. In an organization, especially when they talk about trauma-informed care, is, and instead of saying like, what's wrong with you, or, you know, kind of using that rough languages, to really say what happened, right? I'm interested in listening. And again, like I said earlier, being non-judgmental, being compassionate, right? I don't have to, I don't have to experience it, right? I don't have to agree with it, but I have to be willing to listen to you, right? That's going to be very important, right? Listen to that person and hear what they are asking. A lot of times, some people, they don't need solution, right? Where we give a lot of solutions, whether it's asked for or whether it's gonna work or not. We like, oh, do this, do that, or whatever. But sometimes it's really important to listen and even say, what can I do? How can I help? Right? And sometimes it could just be listening, being there and validating without really invalidating and questioning and minimizing their feelings and emotions, right? And I will tag this along the modeling piece, right? If I'm just waiting for somebody to do it, that's what we've been doing, right? Isn't that a saying where it's like, you see something outside and then when there's a crowd of people, no one is doing anything because everyone is expecting the other person to do something, right? We have to take that initiative. If we see these things or if these things are going on in our life, then we have to be willing to take this as steps to identify our safe and trusted person, to be able to communicate our feelings and emotions, right? To reaching out. And sometimes we might not even want to talk about what's going on, right? Specifically that traumatic experience, but to be able to reach out to that person and just have a conversation, right? In that moment, so that we have that connection. Connection is really important, especially going through traumatic experiences, because one of the impacts of trauma is really isolate you, because you feel like this is just happening to you, that you view yourself differently, you view others different, and the world different, you view change, right? Relationship gets impacted, right? Cognitively, we get impacted. We can't focus, we can't concentrate. We kind of daydreaming, all the symptoms that we talk about. We have fear and anxiety, for some of us, depression. All these things would happen, and that end up isolating us, disconnecting us from other people, right? But we want to be able to get back to connecting, reaching out, conversing, communicating with other people with, like I said, with compassion and non-judgmental approaches.
You hit it lightly earlier when you said people can go through trauma and recover and continue with life. So maybe specific to our culture, you had shared the name shaming. You're ashamed to announce who you are, but I think it's also to remind the audience that this might not be a forever thing for some of us, right?
Yes.
Also,
yes.
as you had mentioned, as to our hearers, if I'm going to Hiwot and telling her this, she has to be responsible to hold that. This is how Meron feels right now, but Meron will have a new identity in the future, right? There is hope.
Yes.
So maybe a little bit of hopefulness.
Yes, definitely. So another thing to keep in mind is that our life is like a puzzle, right? And those event situations that happen are just one piece of that puzzle, right? So our life doesn't have to stop, and doesn't mean it will stop, right? There is, like you said, hope. People do heal from trauma, right? If we utilizing the supports, the resources, and making changes in our life and going through the feelings and emotion without really minimizing and avoiding those things, we can heal, right? So we don't have to blanket our life based on an events and situations that happen in our life and the experiences that we have, right? But to be able to really carry it and move forward. And there is hope. We can do that. There are tools and resources that we can utilize to really heal from the wound or the injury that we have acquired from these things that happen in our life, right? So it's not one and all, where it's like, it happened, I'm done, my life is over, because it's not. And I mean, I don't know people have read the new book Oprah and what's his name wrote. That's really, I encourage a lot of people to really read that book. And they also have a little documentary on Apple TV, and to watch that. Really, it breaks it down to, you know, trauma, you know, not just rape, right, which Oprah talks about, but other people, different experiences that they went through, really fits what we're talking about. That my story doesn't have to match somebody else's story, because that's my story and that's my experience. And then what do I need to do to heal from that and to take care of myself and, you know, loved ones.
Thank you, Hiwot. At this time, we are transitioning to Q&A. Just to remind the audience, I know there's one question pending, so we're going to start with that question. But I also remind the audience that they're at liberty to feel free to unmute yourself and speak, or type in the box if you prefer to do that way. But we are officially on Q&A time. And I feel like we've addressed Meseret's question about it says, how do we encourage that mental, it's all the way, it's a little bit, you have to scroll up a little bit, Hiwot, mental shift to first asking the why in our culture. And, you know, she had mentioned, I feel like you have addressed that, unless you want to feed off it. Then the other question I want to bring your attention to is from Tibby, says, what are the real steps? I know if you can read that questions, and then she brought in a very real problem right now that we see, the, you know, with the news and all. So we are witnessing, right? We're not there physically, but we are witnessing trauma.
So just to answer the, you know, how do we account culture and cultural norms? I think that's important, but to really understand, I mean, that's really a key in any therapy work, actually, that we have to account to the cultural differences, right? And that cultural differences is also what is impacting our experience, right? For someone who has been, who grew up in a certain environment and things like that, when you are explaining these things being traumatic or stressful, they might not see it that way, right? But I usually say that, okay, yes, in the cultural level, right? But what is it to you, right? What is your experience, right? Yes, your culture tells you one way, right? But how are you experiencing it? How are you understanding it? And how is that impacting you throughout your life, right? Like I said, just because I was born and raised back home and have a certain view to it, doesn't mean that I have to continue to believe that, right? We always say that, you know, our values and beliefs change, right? So are we willing to change? Or am I continue to have this belief system that come down from the culture and just to stick to it and continue to go through pain and suffering? Or am I gonna realize that, okay, yes, my culture is this way, right? But this is what I'm feeling. This is what I'm experiencing, right? And then what do I need to do to, you know, take care of that and to heal from that, right? And again, I'm not disqualifying anyone's culture or belief, but if it's not really benefiting you and it's not part of your value and your belief, we don't have to adapt everything from our culture, right? We can select and choose which one we want to travel with, right? Because, I mean, let's talk about Habesha culture. What is the wife's role? Do we still believe that way? Do we still feel that way, right? That was part of the culture, right? But we have adapted where we're like, right? That needs to change, right? So the same thing when it comes to mental health. What are we willing to continue to take as our values and beliefs? And what are some of the things that we need to be able to say, I need to step out of that and have a different belief system and values when it comes to mental health? I hope that answered the question.
That was good. I really liked how you mentioned, what are we willing to change? You know, because we know we've changed some, we've adjusted a bit in the Habesha culture, but what are we willing to change as well? I'm going to read Tibby's question for the
Sure.
recording, and then if you could answer that.
Okay.
Viewer asked, what are some real steps we can take to address the trauma we experience from reading or seeing or hearing about what is happening on the ground in Ethiopia, both in the news and directly from our families who live here?
Yeah. So again, that's the important thing. There's a lot going on back home, like I said, for a lot of us, and then here as well. But strictly talking about what is going on, I think it's important. The first one is to really listen to ourselves and really understand what are we feeling, right? What are our feelings and emotions, right? There's definitely a concern for our loved ones, what's happening, what they're going through, right? And one is attending to our feelings and emotions, right? The feelings that we have based on what our families and loved ones are going through, but also that how can we be a support to them, right? In that sense, really being able to listen, being able to validate their feelings and emotions, right? Giving them, encouraging them and giving them hope, right? And then when it comes to us, when we are recognizing those feelings and emotions, let's talk about it, right? You're not alone, right? If you have a friend or, a family member, have a conversation, right? On your feelings and emotion and talk about your feelings and emotion, and not for political reasons, but really the feeling and emotion that whatever is stressing you out, whatever is causing you stress and pain or traumatic experiences, to be able to talk about those things. You can journal to get them out, right? Like I said, if it's getting to the point that you feel like it's causing you too much pain and suffering, you can seek professional help as well, right? But again, taking care of yourself physically and mentally, right? Talking about your feelings and emotions, recognizing your feelings and emotions, validating your feelings and emotions, everything that we talked about are things that you can do, right? Making sure that you're not watching news after news and social media. Cut down social media, because there are so many things that are being kicked out on social media that you don't even know which one is true and which one is false, right? Cut down social media. Give yourself a break, right? Self-care, that's where it is, right? To be able to set boundaries, right? These are the things that I'm not going to allow to come into my space, right? And if it's about seeking facts and things like that, then find resources that are going to give you those types of information, right? But you can set boundaries mentally, emotionally, spiritually, that is toxic and stressful to you, right? And then taking the steps, like I said, journaling, taking care of yourself physically, making sure that you're eating, making sure that you're sleeping, making sure that you have a time to really sit down and take a deep breath and meditate, right? One of the skills that I use a whole lot and I tell a lot of people is taking intentional moment to pause. Throughout your day, really take a couple minutes to really check in with yourself, right? To really say, like, how are you really feeling today? Do you feel any tension or stress in your body? How can you take care of that? Are you hungry? Are you tired? Right? Are you anxious about certain things or stressed about certain things? Do you need to lay down, or do you just need to get a fresh air? Sometimes it could be as simple as getting a water, right? Because we're always on the go, but we in the autopilot, but we need to take charge and to kind of slow that down and just taking a moment to pause. You don't have to be a mindful or meditation guru to do that. Take a couple minutes, ask yourself, how are you really feeling? Not fine, not good, but really, what are you feelings and emotions? How's your body? Check in, do a body scan. Do you feel any tension or stress in your body? How can you relieve that, right? A lot of times we fall back into these habits of either drinking or drug and things like that. That's not good for our body, and it doesn't solve the problem either, right? It's kind of a short-term fix. But being able to kind of noticing and recognizing, saying that, okay, what is it that I need to do to take care of myself physically, mentally, and emotionally, and spiritually, right? And really simple and moment to pause and recognizing and being aware of it. And if I feel tension, how can I relieve that? If I'm hungry, what do I need to eat? What are the foods that I have in my plate? Are they healthy for me, right? Because the food we eat impacts our hormone, and the hormones impacts our stress level and emotion. It's all tied together, right? So it's like a domino effect. When we take care of ourselves, there's a positive outcome. When we're not taking care of ourselves, it's the same domino effect that it would have, that would impact us mentally, physically, and spiritually.
Thank you so much, Hiwot. Questions from the audience, feel free to use the chat box or unmute yourself and speak. You can ask in Amarinya or Tigrinya as well, if you feel confident doing so. Don't be shy.
Hi, thank you for doing this. This is excellent. Can you talk a little bit about generational trauma?
Yes. So thank you for asking that. So that's actually a lot common, right? And part of it is because throughout the generation, there has not been any healing that has been done, and it's kind of get passed on, right? And that's part of kind of the genetics or the biology that we talked about, right? And I know at some point has mentioned to Miriam before that the same way we pass generational trauma, we also can pass resiliency, that we can pass healing, right? So part of the process is really going to be is that understanding what has happened before, right? And then being able to say, okay, what can I do about it right now, right? So, I mean, especially here, we definitely have seen it with the Black Lives Matter movement and what's going on here when it comes to race and all that. That's really a big part, right? Things that happen, and even in our own life and culture, that what happened in the past continuously get passed on because there is a lot of unresolved and unmet emotional pain that has happened. And we can either be able to kind of step up and or kind of decide to be able to say this is where it's going to stop, right? And that's going to require to be able to say, okay, how am I going to heal from that, right? How do I heal from what has got passed down to me so that it doesn't get passed to the next generation that comes after me, right? Yes, I can't be the only person that solved that problem, but it has to start from me. Like I said, I can't wait for other people to do it. So what can I do, right? So for a lot of it, either, like I said, whether it's that talking about with families and people in our lives to address that, whether that's going to be seeking support and professional help to address that, but really is what's going to help us heal from that is to actually address it and make the decision moving forward what I'm deciding to welcome or accept in my space versus that what I'm not willing to do that. Again, the values, the beliefs, right? I have just a simple example, working with the school system. I have African Americans, I have Latinos, I have Caucasians, I have Habesha people in my caseload. The person that takes advantage of.
We're just going to wait a little bit. Seems like this speaker Hiwot is frozen for a little bit.
Time and discussing and processing. They take their time to talk about their feelings and emotions. And then let's talk about the Habesha and the African American and the Latinos. They don't. They feel like.
Sorry to interrupt you. We missed the first part. You mentioned about the people that you have in your school, and
Yes.
there's one group that seems to take advantage. If you can start from right there, because you were frozen.
Oh, okay. My apologies. So that, like I said, the Caucasian people take advantage of therapy, right? They come in, they talk, they really utilize that time. But when it comes to, the Habesha, or whether it, the African American or the Latinos, they don't, right? What that does is just continues that generational trauma, right? Because they're not talking about it, they're not communicating, they're not addressing it, they're not recognizing their feelings and emotions, right? They continue to believe that if they do talk about it, it's going to bring shame to the family, right? So it goes back to that cultural belief that we
The speaker here
there
has.
goes that stigma that goes with it. So again, taking that step to seek support, to seek help, to educate people in our life about those things, to share information, to encourage people, to give the listening ear when people are talking, to ask questions. And like I said, not what's wrong or what's wrong with you, but really what happened, right? Opening that dialogue and opening that communication. I think I went a lot.
Oh, you hit the hammer. I'm going to focus your attention to one question that came up. I'm going to read the question, and then we will follow the chat box. There's one question, and it says, one from our viewers: how does one deal with passive, aggressive, dismissive people who also lack empathy?
Okay, that's very important. So a couple of things that we can do, right? So once you recognize it and that's happening, it's important to recognize and to use assertive communication, right? To really be able to communicate your feelings and emotions, your wants and needs, right? And then the second piece is going to be boundary, right? So setting those boundaries, letting them know that what are you willing to accept and not accept, right? And then a lot of times I say, you have to ask yourself, is this relationship worth maintaining? Because I cut down family members, Miron, you know me. I love them from a distance. they my family. I can't get rid of them, right? But I can love them from a distance because they don't bring positivity or a healthy relationship. No matter what you do, what you have tried, if it continues to happen, the relationship is skewed, right? There's no balance. So you have to decide whether that relationship is worth maintaining or not, right? That's the first decision that you have to make. And if you decide this is a relationship worth maintaining, then you can decide, okay, how do I need to communicate to this person to get them understand my boundaries, right? How are we going to communicate? How are they going to respect me? How we can have dialogue without really, using a certain word or terminology that is really impacting the relationship and not getting anywhere, right? So it's at the end of the day, I usually say, keep your side of the street clean. So which means that, are you communicating, right? Are you asserting your wishes, your needs, right? Your boundaries, right? Because I can't make anyone do anything, but I can decide what I can do. That's where my control is. I can't control the other person, right? And my control is I can set my boundaries and I can communicate and I can decide whether that's the relationship worth maintaining or not.
Thank you, Hiwot.
Of course.
I'm going to focus our attention to a question from our audience. It says, how do you know if you're picking the right treatment? what are signs of a good therapist or a doctor, especially when resources might be an issue? So I know it's the general questions, but if you could guide our
Yeah. So one thing that I would say for our Habesha community is that you can call and ask questions or kind of have a mini interview to your therapist, right? You can really call them and say, hey, have you worked with this types of culture, people before? Do you have understanding of our culture, right? What are your certificates or credentials, right? Have you worked with this types of people, or have you worked with someone with, generational trauma, or, whatever, experiences that you have, right? You can ask all these questions before you decide to go along with that therapist, right? And then the second part that I would say is that even sometimes after you meet, you have that talk with them, you meet with them, and it's not working out for you, it doesn't mean that you have to continue. You can decide, right? You are in the driver's seat. This is about you. That the person that's sitting on the other chair is they providing you support and resources and guiding you and working through with you. But at the end of the day, it's your treatment, right? So those things are going to be very important, to not be shy about, calling and reaching out to the therapist and asking these questions, to find out, to go to their website, to go to their Instagram or Facebook or whatever that social media they have, to look into them and see if they are the right fit for you. But like I said, call, reach out to them and ask for, there is a free consultation that a lot of therapists would do. So you can call and say, hey, are you the right fit for me? Right? These are my concerns. And what are your credentials? What are your experiences working with, my kind of challenges and problems and cultures and all those things. And the same thing, like I said, whether that's, your psychiatrist or your therapist, you can find out. You can reach out to, other people so that they can refer you to people that they have worked before or worked with before and things like that, so that at least, you have some information to go off of. But the main thing for me is to really call and ask these questions and decide for yourself whether they're right fit for you or not. And then once you're in, if it's not working for you, but be honest that whether it's you or the therapist, right? Because sometimes we do have some clients where they come in and they don't talk, they don't take advantage of it, right? And they can only go on from that, right? But even then, if there is something not sitting well with you, working with that professional person, you can either communicate that and see if that could change, or if not, then you move on to the next one, right? Because like I said, I might not be everybody's cup of tea, right? But I am also open to say, let me refer you out because this is not working. Some might not do that. So if you feel that way, it's your money, right? You're paying for them. It's not free, right? You can say, this is not working for me, so I would move on to the next one. So.
Thank you, Hiwot. Really good question. I've asked Hiwot a similar question, where do I go? How can I find? We're going to open for one more question. I know Tibby made a comment saying that, the issue, she agrees the issue has been someone who can help my parents in their language. We needed better help for Habeshas. And I'm going to perhaps Habesha Health answer that. And I don't know if you want to add anything to that, Mimi, but Hiwot, but we also are open for one more question. So audience, do not be shy.
Yeah. So one thing that I would say is, like I said, there are some Ethiopian communities that, in almost a lot of states that we can reach out to, right? And then when it comes to the language, right? But also there is Psychology Today, that where you can really go in and put down all these things, click all these things to kind of matches what your needs are, right? Sometimes, I might want to refer a family or a friend because I can't see them. So what I would do is that I go in in the Google, and I would put down, Amharic speaking or Tigrinya speaking, therapist or counselor in the area, right? And looking, and then again, once I find them, looking into, their websites and stuff like that, finding out and calling them and asking them questions and stuff like that. So I know that we don't have a whole lot of resources, when it comes to Habesha community, but I mean, there is more of us, really. I'm actually very surprised sometimes, when I find, different Habesha people in the counseling field. But utilizing all these things. But a lot of times here, Psychology Today is the one go-to. If you're not really looking for Habesha speaking, if you do have insurance, you can call to your insurance, and they usually give you a list of providers in your area within a network of your insurance. So you would have more resources in that as well.
Most definitely. As has stated, reach out to your local city and county for information.
Yeah.
I agree with you. There's a lot of folks in this field within the Habesha community. And I'm always surprised when I find a new person as well.
I agree.
We don't have any question going once, twice, maybe. We don't have any questions from our audience, but I believe there's also maybe a contact or something on Habesha Health website for to give for additional questions that you have concerns. We discussed a lot. We talked a lot, and some part made me a little bit emotional because it is so necessary. It is something that we can, as you were talking here, what I was thinking of other things that we talked about, we didn't address. So all to say, it is so important. Let's not neglect our mental health. Not dismiss, minimize trauma and even stress. That's the beginning sometimes. Want to give an opportunity for Hiwot for closing remarks, and then I want to do a little bit about how can we reach you. And
yeah, so like I said, I think the main one is going to be I want everyone to keep in mind that trauma or traumatic experiences are more common than we think, right? So just keeping in mind, keeping that compassion and humanity where we feel like we're the only person that's happening to us. It's not. There is more people are going through and experiencing a lot of the things that we are going through and experiencing. So just feeling and understanding that, right? That's going to be important. The second piece I would say is that take care of your mental well-being, same as, or if not more, that you would take care of your physical, right? Because it's really all here, and we have to, if we're not really functioning well, a lot of things really, we can't really do, right? It's going to be very important. So make sure you listen to yourself, make sure you pay attention to your feelings and emotions. You don't need anyone to validate your feelings and emotions. Your experience is your experience. Your story is your story. Listen and pay attention to that. If you need to support and reach out, there are support systems. There are resources out there. If you're not there, or if you're not to that point, start by taking care of yourself. Make changes in your life, exercising, eating healthy, sleeping, setting boundaries, minimizing toxicity around you, whether that's, like chemical or people or whatever the case is, that's really not feeding your soul, that is really not bringing, joy and happiness and healing in your life, then you have to make those decisions, right? And please, and please, and please do utilize the support system that you have. Try to identify at least one person that you feel safe and you can trust, so that you don't have to carry this on your own. And if you're not getting well, if things are not getting better, please reach out and utilize the resources that you have, the professional help that are out there. Like Meron said earlier, I mean, some of us do have insurance. If we do have insurance, we pay for it, utilize it. There are providers that give a sliding scale. There are communities, like somebody mentioned earlier, through your city and county that are providing, services, short-term services. Utilize those things. But there is hope. We can heal. We can have our life back, but we just have to take that step. That step is acknowledging and accepting that we're not feeling well, we're not doing well. So my action plan is going to be to do one, identify it, take care of myself, find my support system, reach out to them, utilize them. And if it's not getting better, then reach out to the professional help.
Excellent summary. And how can we reach you, me and everybody else?
Yeah, so like I said, I am in the Northern Virginia, in the Virginia area. So if anyone is living in the Virginia area and want to consult, like I said, a lot of therapists give at least 15-minute consult time to just discuss. And then again, a lot of times, if I'm not the right fit, I will do everything that I can to provide the support and resources that you would need, so that you can get the help that you need. I do have a website. It's new. It is NU counselingservices.com. So that's my website. You can go to my website. I have a Facebook and Instagram account. Again, it's the same thing. It's at New Counseling Services. So you can reach out to me and leave a message and leave a contact number, and I will be happy to respond and do the best that I can to support. Like I said, there are people even here that are Habesha providing support, providing counseling other than me. So we work together. We refer people out. Like I said, if it's Habesha, making sure that they getting the support and the resources that they need. You can go to Habesha Health. There are more discussions about COVID, about nutrition. I mean, they have it all. You can go back and check. And like I said, information is important. Please do communicate and share this information with other people. If you know of someone who is struggling, just sharing these resources. And like I said earlier, modeling is going to be important. And instead of waiting for someone to do it, be a role model to speaking, communicating, sharing this information, and you do the best that you can, and we will continue to do the best that we can. So thank you, and I hope this was helpful. And if you have any question, like I said, you can reach out to me, and we'll be happy to answer any question.